Hey, Joe Zarzaur here with Dr. Malone. We're doing a little special segment today on the coronavirus, COVID-19, I guess it's COVID-19 is the name of the disease. I guess the coronavirus is the name of the virus. In any event, they obviously everybody's in a little bit of a different mode this week than they were last week. This week, it's starting to become very clear that the disease, doctor, is or the virus is spreading, and because we're just now getting the testing going, we're not really going to appreciate what the numbers are until later this week, probably. I saw some numbers today from New York that suggested that the virus had already they already found the virus in many people that they had tested. I can't remember the percentage, but it was a fair number. And the concern I think everybody has is, okay, once these numbers come out, are people going to freak out? And that's my concern, is that people are going to freak out because just the numbers look so intimidating. Oh my God, these many people have virus. But I think everybody needs to be reminded that, you know, the realities are this: unless you're 80 or have one of the risk factors or underlying disease processes, then your likelihood of recovering are very, very, very good, like 98%, 99%.
And the symptoms you will experience may not even be appreciable.
Right.
So it may be like more innocent than the flu, which we've known for decades.
And what they're trying to do now, everybody's talking about these graphs where they got one graph where it's going up to a peak and one graph where it's like doing a little mound. They're trying to spread out the infection over time so that the hospitals and healthcare givers are not inundated at one month with all these cases. And that's where the social distancing comes into play. That's where the hand sanitizer and washing your hands a lot comes into play. The longer we can keep this from, the longer we can stretch this out, where the disease process takes a longer period of time to infect the people, the less stress there is on the system, right?
Yeah, the medical system, just the population in general, as far as foodstuffs and people being able to be functional in society, all of that. Otherwise, you come to a screeching halt when it's a tidal wave.
All right, now we've talked about this before. We talked about the coronavirus before. Where's the best place to get information for Pensacola folks?
So I would say that the Florida Department of Health, if you Google Escambia Department of Health, both of them have really useful and easy to understand websites, as well as what they call a toolkit. So that's one good place. There's also hotlines listed on there where you can call and or email 24 hours a day, and that you can learn more about what your next step should be. So that's probably the best resource.
I've heard different things, but how long have you heard or read does the virus live on things other than air? How long does it live on like door handles and faucets and things that you touch that other people touch?
Yeah, so last week we mentioned that, and what I had stated was 9 hours, is up to
9 hours.
However, recently, again, there's something we're continuing to learn about,
right.
And now they're saying up to 16 to 20 hours.
Okay.
So what I told you last week was 9 hours on inanimate metal objects is what it could survive on for that period of time.
But now it's up to 16 or 20.
Yeah, and it's not because the virus is stronger or anything like that. It's just that
we don't know.
There's more of a setting to do some testing with it. So it's not that they didn't do the test before. It's just the manner in what they did it and what.
And then I heard today that if a member of your family has it, that your whole family should just stay in place, shut down.
Yeah, because everybody there is going to get it. Okay, very likely.
Right.
And also, the idea that you're going to get some sort of herd immunity from it, where they've all been infected and then they're immune from a reinfection, that's actually a good thing. It's not to say go out and try to catch coronavirus, but if you've already been exposed, close contact, and chances are you're going to get it, just stay home with them. Don't all of a sudden take what you have and go to work with it.
All right. Now, if you're still working, this is Monday of March the 16th, right? Mm-hmm. If you're still working, your employer's making you work, should the employers be doing something to make sure that, like we're doing here, where they're monitoring your temperatures and making sure people that have a temperature don't come into the workplace? Yep. Should they at least be doing that?
Yeah, and so for all these relief efforts that are out there as far as the financial part, this is a big part of it, where employers are being encouraged to effort ways to get people to telecommute, get people to have other duties during this time that can be done from home, give them some flexibility in taking time off if either they are sick or their family members are sick, because them bringing it into a workplace where they might be exposing the general public or coworkers is just.
And this morning we had an employee here who remain anonymous, showed up, and her temperature, she didn't know she had a temperature. She had a temperature. She took it several times, and then we had Dr. Malone confirm it, and she had a temperature. I sent her home, and it come to find out she's actually got a little cough, and her roommates are sick, and so, or at least one of them is. And so because of that, we've actually, in my opinion, we're trying to take steps to move so everybody's working from home, but today was a transition day. And so my hope is we can move towards making sure that we have everybody at home by tomorrow or the next day working from their home. I hope other employees are doing that. At the very least, they should be testing everybody. And I heard every 4 hours they should test temperature, because you can not have a temperature at 8 in the morning and then have one at noon.
Yep.
And so it needs to be sort of an ongoing process. Anything else you can think of for this update? We're going to try to give updates every day this week.
No, I just want to say that if you think that you're being hysterical or like worrying too much, think about where you were last week and not where we are now. So it's not outside of reason to start saying, what are the next steps that I can anticipate? That's not to say to stockpile and do all that crazy stuff. I'm saying just for your own general planning with your family, your work, and your coworkers, your boss, things like that. Just always have that on the plate.
I thought that the president made a good point yesterday. He said, look, we're going to keep the supermarkets open. We're going to keep all the supply lines moving. So don't try to go to the store and buy 6 weeks worth of groceries. Go to the store and buy a week's worth or several days worth. You're going to be able to go back.
Yeah, this isn't like a hurricane where we lost utilities.
Right. Yeah. Hopefully that's not going to happen. So in any event, we're going to come back tomorrow and do a little update. The firm is also still seeing clients in person, and we've set up a virtual conference room through the Zoom software and hardware. And we're going to talk about that in a different video, but I did want to touch base with everybody just to share a little bit of Dr. Malone's research today on the progression of the disease, and we're going to try to do this every day this week.
Actually, I'll have one last thing to add.
Oh, sure.
So this big boom you're talking about, they're not necessarily new cases. We're just measuring stuff that exists.
That's right.
Already.
That's a good point. So it's not like this is something that's happened because it's been more time. This has probably been happening, and we didn't know it.
Now we're measuring something that's existing.
Correct.
So it's not a huge upslope where that it's that infectious that rapidly. It is rapid and it is infectious, but it's not that steep. So those cases were there 4 days ago. We're just labeling them now.
Yep. All right. Call us if you need us at 855-HIRE-JOE or on the web at zarzaurlaw.com. We'll be in touch this week. Each day we're going to do a little update. Thank you. Stay healthy. Wash your hands.